Hi, my name is Sue Turner and I'm the blood transfusion practitioner, and I have a few things here just to make sure that you're confident with what you're doing when you're taking blood for blood transfusions and when you're prescribing. You'll see all of this on the Moodle, which hopefully you'll have completed before you start. So this is just to go over it to make sure you're happy with it. This is the blood transfusion group and screen form. Very self-explanatory, but if you do something wrong on it, it will be rejected by the laboratory. So please make sure that you take great care in what you're doing. Patient identification is an absolute must. All the patient details at the top. You can put a patient identification sticker on here, but please make sure it's the right patient's ID. There's then a few details down below which you can fill out. It then says the name of the requester, which you have to put in, and at the bottom here it is whoever has taken that sample must be the person who signs this, and it says, I confirm the patient's ID on this request form has been checked with the patient verbally and or their wristband, and that the sample has been labelled in the presence of the patient. So when you do this, you go take your form and your bottle to the patient's bedside, identify your patient, take your blood sample, label it all up at the patient's bedside. Please do not leave that patient's bedside until you have labelled it up. If you do, you have the chance of picking up somebody else's details and filling out the wrong details on the bottle. Down this side of the form, it is what blood products you want. So there's red cells, platelets, plasma, and how many of those units you require. It's a box down here whether this is urgent or not, and right down the bottom is the telephone number for the laboratory, whereas all urgent requests must be discussed with the laboratory, extension 2402. And if it's out of hours, it's 854, bleep 854. Out of hours for the laboratory is any time after 5 and any time before 9 o'clock in the morning. Okay, so just remember that too. These are the bottles for group and screen. These cannot have a sticker on them. They will be rejected if you put a sticker on. They have to be handwritten by the person who takes them. All the details, requested details, are around the side here. Please make sure the bottle is in date. Again, it will be rejected if it isn't. You can see I've got two here. One's adult and one's paediatric. We will accept in the laboratory a paediatric sample if you are having great difficulty getting some blood from a patient. But preferably the big one for adults. Obviously the smaller one for peds. Okay. Then we have our prescription chart, which I'm sure you'll be involved in too. This again has got all the details that you need to fill out. Patient details at the top. And across here it says the prescriber must complete numbers 1 to 6 before a transfusion can commence. So we have the reason, the HB result, any special blood products required. And it does say here, yes or no, CMV. So please remember that all pregnant women must receive CMV negative tested blood. We then have irradiated, and when you complete your Moodle training, that will show you everybody that needs to have irradiated products. You can also ask the patient if they carry a card, and that card tells you that they need to have irradiated products. There is a space on the form, the blood form, if the patient needs CMV or irradiated products. So we are to special blood products. Then it says, do you need a pre-med? That usually is if the patient has had a history of transfusion reactions or allergies before. Something like Piriton, hydrocortisone, just in case. And then consent. So we have consent in the middle here. Obviously that's getting the patient's consent if you can. It says patient is unable to consent, then you can sign this. Down the side, this last one here says patient's weight, and that relates to when you have a patient that's very tiny, and the calculation that we need to work out, if someone weighs less than 50 kilograms, we're talking about 4 mils per kilogram. Each of these bags are roughly about 300. So to our tiny patient, they only actually need 200 mils. If we give them too much, we have that chance of overloading. So be careful when you have tiny patients. And then the rest of this is the date and the time that you're prescribing, the product that you want them to have, how quickly you want it to go over. All red cells must be completed within 4 hours of coming out of the blood fridge. Other products, such as platelets and plasma, they can be transfused within half an hour. Then your signature here, and the rest is to the nursing staff to do when they put the blood up. On the back you will find the blood transfusion observations, and the nurses will use this to record all the transfusion observations.